So how do you know if you got one or you're not, and not just a corn or a callus? What's the difference?
Yeah. And so a lot of times when we see a wart on the foot, one of the main ways that we can differentiate them is that usually warts almost look like a head of cauliflower. It's kind of bumpy and has that kind of cauliflower-like appearance. A lot of times when I'm writing my notes and I'm dictating my notes, that's one of the things I use. I say the lesion had a cauliflower-like appearance. And that's kind of the telltale sign that you have a wart instead of just a regular old callus. The other thing that distinguishes a wart is these little dots in them. And so a lot of times, if you try to kind of scrape it off a little bit, you'll see these little dots in the center of kind of that lesion. And these are capillaries. So capillaries are very small blood vessels. And so when the wart gets kind of in the skin, it induces the body to make blood vessels in the area to really try to fight it off. And so you see these little dots in there, and those are the capillaries that your body is making, that the wart kind of induces. And so those are the two main things. It looks bumpy and kind of like cauliflower. People are not going to eat cauliflower now.
No.
Yeah, and then they had those little dots in them. So those are kind of the two main things. One other thing is that a lot of times when you press directly in the center of a callus, it hurts because when you have that pressure there, it hurts. But with a wart, if you press kind of on the side of it, that what usually hurts. It's not usually in the center. It's usually kind of on the side of it. Not all the time, but that can be another telltale sign that if you press kind of towards the side of the wart, it hurts. Not all the time, but classically, warts hurt with, we call it lateral compression when you press on the side of it.